Welcome to the Liverpool Women's Hospital VR suite. In this immersive experience, you are in control. Feel free to look around and explore the spaces. If possible, use the supplied cardboard viewer and view in the highest resolution possible. You are approaching the main reception area. To your right and left, you will notice the self-service screens. You will need to head here to check in when you arrive at the site. To the far left is the main corridor. You will be sent here after checking in, and it's from here you will find the main areas of the hospital. As you enter the admissions lounge, you will see the admissions check-in desk located to your right. This is where the ward clerk will take details such as your name, date of birth and address. At this time, you should hand over any final documentation regarding your appointment. We advise that you leave any unnecessary valuables at home, such as watches, jewellery or money. Once check-in has been completed, a nurse will ask you to take a seat. They will then direct you to one of the nursing rooms where they will take your baseline observations. Your anaesthetist and surgeon will then see you and discuss your treatment. This is where any remaining questions you have can be asked. Following these conversations, you will be directed to one of the changing rooms and will change into the surgical gowns provided. It is also recommended that you bring in a dressing gown and slippers to wear while you wait. A member of staff will then escort you and your medical notes from the admission lounge to the forward waiting area via the main corridor, where you will be greeted by a member of the theatre team. As you enter the forward waiting area, you will see the reception desk on the right, the main theatre corridor straight ahead, and the forward waiting bays to the left. Here, there will be a patient trolley waiting for you in the bay corresponding to your theatre. Once you are on the trolley, staff will then reconduct the pre-surgical checklist to ensure your safety. Your slippers and dressing gown will be handed to the ward staff, who will return them to the gynaecology unit. When the theatre team is ready for your operation, a member of staff will come and collect you on the trolley, performing identity checks before taking you down to your theatre. As you enter the anaesthetics room, the staff will then introduce themselves by name and role. They will then go through the surgical safety checklist. This involves asking you questions and asking questions of each other. Once these checks have been done, the scrub team and surgeon will withdraw, leaving you with the healthcare assistant, anaesthetic support practitioner and anaesthetist. The staff will then connect you to the monitoring equipment that will be used throughout your procedure. This will measure your heart rate, blood pressure and oxygen levels. You may hear the monitor next to you start beeping steadily. This is normal. Following this, a cannula will be inserted into the back of your hand. This will be used to administer the anaesthetic, whilst an oxygen mask will then be placed over your mouth and nose. It is worth noting at this point that Liverpool Women's Hospital does have a latex-free theatre. As you begin to wake up in the recovery area, your monitoring equipment will still be connected and your cannula may be connected to some fluids. This will ensure you are hydrated, and some pain medication may also be administered in this way. You may also become aware of a member of staff checking for any post-vaginal loss. During this time you may feel disorientated, however this is completely normal and you will be carefully watched over by one of our recovery practitioners. The recovery practitioner will view and assess the dressings that have been applied to you and will be checking your vital signs at regular intervals. If you feel any discomfort or nausea during the recovery process, please inform your recovery practitioner, who will do everything they can to help with this. Once the practitioner has assessed you and confirms that you meet the discharge requirements, you will be returned to either an inpatient or day case bay, from which you will be admitted to the ward. Depending on the procedure you have come for, you may be returned to the Bedford unit. In this case, the process will be very similar, with slight variances to locations.